Okay, today we're making a post mostly in response to one of the responses that we got on our Facebook page that had quite a few what we thought were good questions that should be answered. And specifically, the post asked about the number of people that have died from the vaccine. While this is a relatively vague determination, maybe the answer is 3. And that might be related to the blood clots with the Johnson & Johnson vaccine. But in all of this determination, there is some vagueness about what is the background rate of blood clots in the first place. Also, we are now aware of this issue. And if you get this in the Johnson & Johnson vaccine, we now are more ready to be able to treat this when we were when this first came up. So out of the millions of people that have gotten the vaccine, 3 blood clots. The person also asked about the adverse reactions, and I think that's a very fair question. What are you looking at when you're deciding to get the vaccines? There's probably 4 issues most people kind of know about. There's myocarditis, which my numbers show 41 out of 1 million, and most of those are mild. There's something called Guillain-Barré syndrome, which is a neurological condition where people become very weak and can last for quite some time, but almost always there's recovery. My numbers show there's 100 reports out of 12,500,000 people. In the blood clot numbers, we're looking at something like 1 in 300,000. When you talk about an allergic reaction, a severe allergic reaction like anaphylaxis, we think the numbers may be around 1 in 90,000, although that is clearly a treatable event. So in all those, you noticed that I was talking about numbers of 1 in 1 million kind of numbers. Now, when you talk about what are the adverse reactions to getting the COVID infection, well, we've got more than 500,000 deaths in this country. That's astronomically a higher risk than the vaccine. The other issue that we ran into was, is there some kind of proof that we can guarantee that there won't be problems with the vaccine later? And the answer is nobody can guarantee that. Almost all other vaccines, the issues arose in the first few months. We're past that with these vaccines. We doubt that there's going to be a lot of other issues come up. But the truth is, it could happen. Now, if you say, what are the issues that could come up later with getting the illness? Well, we're seeing that, and it's pretty consistent. And if you look at some of the sources that I have, the patients report fatigue, shortness of breath, chest pain, cough. A lot of them have smell trouble. Some of these patients are doing this in my practice 6, 8, 9 months still. Hopefully most of them are going to get better. Some of them probably will not. And so there again, it becomes a risk of the vaccine versus risk of the illness. I think that the illness is astronomically in the thousands more dangerous than any risk that might be perceived of the vaccine. And ultimately, I think everybody has to make a decision. We are in the middle of what is probably another wave now. I think that most people need to get vaccinated as soon as they can. I think the risk and concerns that are put out on the internet are overstated to the vaccine, and a lot of people don't know the risk of the illness until they get it, and then there's not that much that can be done other than hope it just works out. I hope the biggest message today that you'll get from this post is go out there and get the vaccine, knowing that the numbers vastly are in favor of vaccinating versus taking your chance on the virus. Thanks for your attention.